Thank you so much for joining us on this episode of Family Matters. My name is Kiarie Museo. November is Lung Cancer Awareness Month. During this time, organizations and governments take time to make awareness about this disease and, of course, emphasize on the need of research. According to the World Health Organization, about 2 million cases were reported last year, and notably lung cancer causes more deaths even than breast cancer, colon, ovarian cancer combined. 80% of these cancer cases are caused by smoking. What are some of the symptoms of lung cancer? How can it be prevented? What are the journey like? What is the journey like for a lung cancer survivors? We are talking all about that on our show tonight. And next to me, I'm introducing my guest is Thomas Lindi. Thomas Lindi is a coordinator at the Kenya Tobacco Control Alliance. Then next to Thomas is Margaret Waweru, who is a lung cancer survivor and at the same time the coordinator and CEO for the Hope for Youth Against Cancer. And then we have Dr. Gladwell Kiarie, who is an oncologist. At the far end is Ruth Wanjiku, who is a lung cancer survivor. Welcome to the show and thank you so much for joining us.
Thank you.
Let me start with you, Doc. Maybe you can tell us how lung cancer, maybe a few statistics because you interact with these patients. How serious is lung cancer in the country right now?
Thank you very much, Purity, for having us in the show to discuss an important disease that needs to be contained. Now, around the world, lung cancer is the leading cause of mortality and morbidity. And in Western countries, you find that it actually kills more women than breast cancer in the United States, in England and Europe. Now in Kenya, in our Global Can data of 2018, lung cancer was actually number 15, with 678 cases documented annually. Now that may be because we are either not picking up all the people who have lung cancer, and we do suspect that majority of our patients who may have the disease are treated for pneumonia and pulmonary tuberculosis. Now, the diagnostics of picking up lung cancer includes doing lung biopsies. Not many are picked through sputum tests, doing bronchoscopy, which are quite, not quite available around the country. And that could be the reason why we are not picking all our lung cancer cases.
Yeah.
So as much as lung cancer does not come top of the charts in our country, we do believe that it remains a big problem because most of it is not being picked up.
Yeah, and you're saying most of the patients are treated for different conditions such as pneumonia.
And pulmonary TB.
Yeah. What are the exact symptoms of lung cancer?
Now, lung cancer symptoms sometimes may mimic those of pneumonia and TB. That includes having a chronic cough, chest pain, coughing out blood or what we call hemoptysis, having water in the lung. Patients found to have water in the lung or a pleural effusion are frequently treated for pulmonary TB. And they'll deteriorate and probably we lose them before the diagnosis of lung cancer can actually be made. Weight loss, hoarseness of voice, swelling of the neck or what we call lymph nodes may also be symptoms of lung cancer. Sometimes when it spreads to the bone, it may cause bone pain, bone fractures, and sometimes even what we call cord compression. We also have other manifestations of lung cancer like what we call Pancoast syndrome, when the upper part of the lung causes pressure to the nerves around the neck region, and patients will come with ptosis, or one eye closes. They don't sweat on one side of the face. Sometimes the symptoms of lung cancer may what we call paraneoplastic. They are not direct manifestations of the growth itself. So patients' skin color may change. They may have nerve problems due to some of the factors or proteins that are produced by the lung cancer itself.
Yeah.
So those may be some of the symptoms of lung cancer.
Right. Tom, according to the World Health Organization, 80% of lung cancer cases as a result of smoking. Tell us, in our community setup, are we going slow on smoking as a country, or where are we at?
I think our situation is not very good as a country because we have seen an increase in smoking rates, and we are actually appealing to members of the public to relook this issue, because as our good doctor says, the cases of these diseases are rising. and it's upon the family to take it as a family matter right now, because most instances we have seen people throwing it to in a family setup. When there is a smoker within the family, they throw it to the person himself, that the father is smoking, so the mother will not care about that, or the father is smoking, the children will not care. But as a family, this will affect when it hits you that someone has been diagnosed with lung cancer within the family. It will actually deplete all the resources within the family, and the family will end up suffering. So we feel that it's an issue that should be picked up by the family itself, so that we have a conversation around the family, so that we can be able to actually reduce the rates of tobacco and tobacco consumption within the country.
Yes. And you'll be telling us some of the products that are commonly used in Kenya.
True.
Margaret, when were you diagnosed with lung cancer, and what did the doctor say was the cause for that?
Let me tell you, I have journeyed for a long time, and maybe I can start from the time I was diagnosed with cancer itself of stage 2B, the breast by that time. And then 12 years later, that was in 2010, that's the time I developed lung cancer. By that time I didn't know, because I had gone round to different doctors, and of course just what Dr. Kiarie is talking about, the causes of these, I had thought, because there was continuous cough, throat, and I thought maybe it's TB. I was also, some doctors had thought it was asthma, and still I was taking medication on that, and others maybe much acidity in the body, until when I was referred to India. That's the time they realized, through the PET scan exam, that's the time they realized this is lung cancer. And all the areas that were affected, and that cough, the neck and whatever, all that I can confirm with what Dr. Kiarie is telling us. Yeah. And actually I remember when I came back, the doctor I was referred to, and I didn't know her by then, was Dr. Kiarie. I'm surprised that we are here. We're with her today. Mm-hmm. And I think she knows my journey. And even that time I was stage 4, and nobody knew that I'll survive. But I thank God that I did.
All right.
Yeah.
How about you, Ruth? How is your journey like? When were you diagnosed, and what did the doctors say was the cause for the disease?
Okay, thank you so much. I was diagnosed with cancer when I was very young. Yeah. I was 16, but I got amputated when I was 17 years. It was osteogenic sarcoma, but it spread to the lungs too, and I got lobectomy. Yeah. On 2015, it's when I got diagnosed with cancer. It started just like a little pimple below the knee, and I did all the scans and tests, and I was told that I had osteogenic sarcoma, and I got amputated. Then after 2 years, I started coughing, like the way Dr. Kiarie said, and at first I was treated pneumonia. Then I insisted that I needed an X-ray because the pain was too much to bear. So I told the doctor I need an X-ray. I got the X-ray, and I was told that I had a mass, which I didn't know what was the mass, and the doctor didn't tell me like you have to do this or that, because it was just a local hospital. So I went to a better hospital. I got a CT scan. Then after that, I did CT biopsy. I was coughing. I was feeling pain in the chest, and I was told, after the CT biopsy, I was told that I had lung cancer. It was at the last stage, and it had affected the whole of my lung. Then the doctor said that I should do chemotherapy. Then later on, I do surgery after shrinking the tumor. But unfortunately, my body was not responding to the treatment, to the chemotherapy. So, in fact, instead of the tumor shrinking, it was getting bigger every single day. And after 12 sessions of chemotherapy, the doctor told me that he cannot see any change. So he told me that I should do an emergency operation because it might affect the other parts. And my lungs might end up failing, and you know how if your lungs don't work, you'll die.
Yeah.
And it had already affected the heart already, so many parts, but they were most concerned about the lung, mostly about the lung. So I did lobectomy. They removed the lung, and from there I went on with the treatment. I did another 6 chemotherapies, and the tumors disappeared.
Yeah.
Yeah, I thank God for that.
All right. Doc, for the 2 cases, the cancer started as a different kind of cancer, and then it's a matter of spreading to the lungs. For her, it was breast cancer. The same story with her. What exactly is the cause for lung cancer?
Now, we need to differentiate a little bit what the 2 ladies have told us. So what they have is stage 4 of a primary osteogenic sarcoma, and also for breast cancer. So what they have in the lung are what we call secondaries to the lung. And of course, they manifested at different times after their primary tumor had been diagnosed earlier. They are what we call primary lung tumors that start from the lung. And those, will be of different histological types. So we have small cell lung cancer and what we call non-small cell lung cancer. And among the subcategories, we have different types. So they are primaries of the lung. They too can spread. They can go to secondaries in the bone, in the liver, and in the brain, and in other parts of the body.
All right. And now for the lung cancer itself, what are the possible causes for that?
Now, as you rightly said, cigarette smoking and all other, inhalation of tobacco is around the world thought to be the primary, most significant risk factor. Then we have what we call second-hand smoking. If you live with somebody who smokes, if you work with somebody who smokes, and I guess that's why in containment of this risk factor, we have designated smoking places and rules in workplaces. Those are the primary associations of lung cancer. We do have lung cancers that are caused or happen in non-smokers. There are certain histological types associated with that. We have lung cancer associated with asbestos, with chemicals like radon. We have inhalation chemicals like cadmium, vinyl chloride. People who work in mining industries, where they make dyes and other certain things, rubber industries, some of the chemicals like cadmium that they inhale, of course, predispose them to certain primary lung cancers. Then we have patients who probably have been radiated before for breast cancer. Those radiation exposure can predispose them to getting a primary lung cancer later on. We have people who have family inherited conditions whereby if they had a 1st degree or 2nd degree relative with lung cancer, can also get lung cancer later in life. Those are some of the known risk factors for lung cancer.
Yeah, but you said the primary cause is smoking. So maybe how does smoking cause lung cancer?
Now, cigarette smoke has certain carcinogens. Carcinogens are certain chemicals that will cause certain genetic mutations or changes in our genes that will change the cells, and then they become abnormal. So if it affects, what we call tumor promoter genes and tumor suppressor genes, our bodies have a very good balance. Cells are produced and they live for a certain time and they die when they are meant to die. Now, when cells become abnormal, they sort of get a certain mortality where they will not die when they were meant to, and they proliferate or grow at a rate that is also abnormal until you get a little growth in the lung. Now, that growth continues to grow in an abnormal fashion, not regulated by the body, and it doesn't undergo what we call programmed cell death. So it will grow unregulated without any control until it starts causing symptoms. So if you did a chest x-ray to somebody who is coughing a lot, you see a growth in the lung. Then it continues to grow until it infiltrates a blood vessel and they can start coughing blood, having chest pain. Then it will spread to the lymph glands, and that's what I was talking about, getting, for example, swellings around the neck. Then it will cause pressure symptoms, so people start having pain, and as it's growing, it may form water, what we call a pleural effusion. That may be some of the manifestations. Now, the appearance on a chest x-ray and the symptoms we've talked about, like chronic cough, sometimes may lead doctors to treat this patient for common causes of chronic cough and water in the lung, like pulmonary TB in our setup. But the patient will not improve. The growth will continue until now it will cause other manifestations of spread, either to the bone or to the liver or to the other parts of the body. There are certain types, for example, the growths that grow along the top part or the apical part of the lung that will put pressure on the nerves such that your voice becomes hoarse, or it affects the nerves that control your eyelid and your eyelid starts closing. It may affect the nerves that control sweating on that side of the face and you lack sweating on one side of the face. Sometimes the tumors produce hormones or certain chemicals in the blood that affect your skin color. So people may start darkening and they don't know why. Or they may start having problems with their nerves that are not caused by direct compression. These distant effects of the malignancy are what we call paraneoplastic syndromes. So from a small growth that is caused by a trigger, this side cigarette smoking can lead to a malignancy.
Yeah.
We usually say that the people tell me, Daktari, how come so-and-so has smoked for so many years and doesn't have lung cancer? We think that you may be born with a genetic predisposition, then the environmental trigger, this time cigarette smoke, leads to the development of a cancer where certain genes are dysregulated. So they stop suppressing the tumor factors and promoting them instead.
Right.
Yes.
All right. Tom, should we be having designated places for smoking, or how well do we prevent lung cancer as far as smoking is concerned?
Okay, within the city of Nairobi, we have designated smoking areas, as they call them, smoking zones. But it's unfortunate that they are not up to standard. A smoking zone should be, according to the World Health Organization, a place that is enclosed in such a manner that the smoke does not come out. Okay? Maybe it's sucked somewhere else and it does not affect the environment. But what we have around, we call them, actually those are death traps for Kenyans. Because like when you go to Uhuru Park or when you go to GPO, we have smoking zones there. But the smoke is affecting the buildings around. Okay? So we are actually advocating, if the government is listening, these smoking zones should be removed from where people are. Okay? And if they want to create those smoking zones, they make sure that the smoke does not affect, because when you walk around, or you'll just feel the smoke. And imagine people who are working in offices above the smoking zones. They are exposed to this tobacco smoke that will actually eventually have a toll on their health. And we say that tobacco in its entirety, as you had asked, all the tobacco products, we regard them as vermins. Actually, they are disease-causing products that, if possible, they should be banned from our market. It's unfortunate that the government is not taking adequate action as required to protect our people, to protect our public, to a point that we are just exposed without nobody actually taking any action. So this is a clarion call. As Dr. has said, when you smoke, you are exposing yourself to more than 7,000 chemicals, and 70 of them are known to cause cancer. So imagine a population of, it's estimated that 5 million smokers within the country. This is just a disease. This is a catastrophe. This is a danger that is knocking on our doors. If we don't do anything, our future generation will blame us.
Yeah. There was a ban on shisha.
Yes.
Maybe would you say the government is doing enough to maybe stop or protect its citizens? And to add on that, what are some of the commonly abused or products?
First of all, I would like to commend the government for that action. The ban on shisha was handy because this thing was actually coming in as a wave. Before the ban, you could move around each and every bar and restaurant. There was a shisha place. And without people knowing, they were being exposed to this smoke that will move within the whole building. And also the sharing of the pipe is known as a form of a risk factor so that people could get diseases. So the ban of shisha came in handy, and we would like it to extend it to other tobacco products. Right now, there is e-cigarettes that are finding their market within the country, and we like also the government to rise up and regulate these products. If at all, they can also ban them so that we can protect our population. But also, when you look at cigarette smoking and also the couverts, the snuff, and also many other types of tobacco that we find within even our rural setups, whereby people put it in their noses, okay? So these are products that we believe they're harmful to our health, and without knowing, they have been attributed to cause the many diseases that we are now seeing within our country.
Yeah. All right. Margaret, let's talk about your treatment journey. You know, you said it was diagnosed 12 years ago, and then you went to China, and then you were being treated for other symptoms before they found out it was lung cancer. Maybe now you can tell us, after it was found out that you had lung cancer, how was the treatment journey like? You can also include the cost of treatment.
Thanks, Purity. Once you're diagnosed with cancer, it is a journey that it's quite expensive, because from the time I have survived 22 years, but on lung cancer I've survived since 2010. And to maintain a patient on that type of cancer is very expensive. Let me say, from the time one is missing the facility in the nation, because like why we were being referred to India is because there was no PET scan. And PET scan is a machine that helps one understand where you are ailing from. And of course, from the trip to India, through the examination and the medication, it is a journey. And this is where families have lost a lot of their wealth. Some are not even able to educate their children, and it becomes quite expensive. That is why at times, you involve even members that at times people do not even understand you. I remember I did a fundraiser on 3 occasions, and at times you get fed, fed up. People see like you are just disturbing their pockets. And let me tell you, when you are diagnosed with that, like when I was told I'm stage 4, one would think, I just thought, now, tomorrow I'm dying. And the other thing is that the families get affected. Other times you think there's no need of taking that medication because tomorrow you are dying. You're just misusing the resources of your family. But I want to thank God because the doctors we learned to, some of the doctors have a heart to help the patient. Like the doctor I landed to in India, who is Dr. Jadav and is known by Dr. Kiarie, he did not even look at how much I am going to spend there. But his is just to treat until he sees that the patient is okay. And the other thing I was happy about is I was treated, but they didn't tell me to what extent I was suffering. Though my voice was, I had almost lost my voice, and the lung on the left side, okay, the doctor was telling me it was like a baby lung. It was a small one, and all the tumors on the neck and the throat, these were all disturbing me, and also the weight was going down. So it is a journey. Sometimes even to the family members, it is not easy. It is not really easy, and you know, like me personally, I lost a lot of things. Today, you know, I was, you are a business person. The business is gone. You are a farmer. All those things are gone, and then you are left there. And you know, to treat this, because doctor is here, it is a continuous process. Even up to now, I am still taking some medication. So it is tough. I don't know how much you'll be talking about, the cost of it, but it is, it is quite an expensive thing to maintain.
All right. How about you, Ruth? What are some of the challenges that you have faced as a lung cancer survivor?
Okay. You see, number one, treatment, it's very, very expensive. You, like me personally, I was using 157,000 in 3 weeks' time, in every 3 weeks. So like, you go for this chemotherapy, then after 3 weeks, you go for another chemotherapy.
137,000.
And 57.
Yeah. Was that in a public facility or a
No,
private
a private facilities.
All right.
You see, if you go in a public facility, they don't have the machines, and mostly there is a very long queue. So you find some people even dying on the queue. So I personally, I was using a lot of money. Number one, that is the challenge. Number two, it's losing things. Like you might lose friends, you might lose like everything, even the family members, because of the expense of the medication. And being in this journey, you have to be so much strong, because maybe something like losing hair and weight. I was 38 kgs, yeah, and there was a time that doctor said that he also doesn't have hope, because this thing is really pressuring me. I was young and I was supposed to fight because I was strong, but through the medicines, they made me became so down, and lose hair, weight. My nails became black, and my tongue became black. So not everyone can accept you the way you are when you are fighting cancer. Mostly you find people who are maybe you when you lose one part of your body, people may not accept you that way, and people will start doing stigma all the time, and that one may also kill you. And another thing is depression. When your family doesn't accept you and love you, you get up depressed, and being depressed plus the medication, you end up losing your life. And also, people should know that cancer is not a death sentence, and people are getting healed from cancer, and most people are free from cancer. And at the other hand, people are also dying of cancer, because number one, if you don't get the right resources, like if you don't go to the best hospital, you cannot afford a good hospital because of the cost. If you cannot find love, even from the family members, you end up dying. And maybe kuna mtu unapata is even selling land because he or she cannot afford the medication.
Right.
So that is another thing that is killing people.
All right.
Yeah.
All right. Doc, do we have a challenge when it comes to treatment of cancer in the country, or why do we have to have some patients going to either private facilities or going outside the country to seek treatment?
No, a lot has changed since the two ladies probably began their journey.
Okay.
With some is a hopeful end. I met her after she came back from India. She had been referred there. And since the time, she said she has journeyed for over 20 years, a lot has changed in that period of time. The PET CT scan that she talks about is available in Kenya in one of the private facilities. The National Hospital Insurance Fund is subsidizing up to 2/3 of the cost of a PET CT scan. The availability of CT scans and interventional radiology to be able to do a biopsy, to be able to do certain blood tests even for other malignancies, has really become more accessible to the mwananchi. We saw the numbers of radiotherapy and chemotherapy double and triple when the National Health Insurance Fund started facilitating and paying for even chemotherapy.
Right.
And many people turned around and stopped going to India, because if you could have your NHIF pay for you here, it gives you greater access, and what you even top up for chemotherapy and radiotherapy gave very many people access.
Yeah.
So we do still have hope. A lot still yet remains to be done in creation, especially with devolution of health, empowering of the county hospitals. We've seen some of the provincial hospitals rolling out very comprehensive oncology services. I'm directly involved with the Nakuru Provincial Hospital provision of oncology services. They have radiological equipment, they have pathologists and biopsies, access to chemotherapy, and thousands of patients have actually received treatment. So I guess as we go on, because of advocacy, from these two ladies, talking about their journeys and how difficult it has been, creates pressure, not only to the government, but in public sector, in sort of pulling up their socks so that people don't need to travel out to get access to care.
Yeah.
Because I think they can tell you there are difficulties all around.
Yeah.
Yeah.
So what are some of the treatment options for lung cancer?
Now, lung cancer, as we said, once a diagnosis is made, there are different types. We call them histological types. Now, once that diagnosis is made, you stage the disease. You stage the disease using CT scans. You can use a PET CT scan. Some cancers are early enough to be operated on, where surgical resection followed by radiotherapy may even cure the patient. But unfortunately, very few patients fall in this category, whereby a surgical resection and some chemotherapy or radiotherapy are going to cure them, because as you've heard, majority of patients come too late when they have stage 3 and stage 4 disease. The other modalities of care are giving chemotherapy drugs. The type of drug that we give is dependent on the type of cells that we find. If, for example, it's an adenocarcinoma, a squamous cell carcinoma, a large cell tumor, small cell lung cancer, the modalities of drugs we use are different. Now, in addition to that, there's some mutation testing that we do on lung cancer cells, or what we call specialist tests that will be able to predict if a patient is going to respond to some of the targeted therapies, which are also locally available. So sometimes we don't start elderly patients or patients who are very weak on chemotherapy. We prefer to test what we call immunohistochemistry testing and be able to give them immunotherapy or targeted therapies. Now, we do have, cheaper targeted therapies, drugs that we call elotinib, gefitinib, available locally. They are covered by NHIF, but some of the immunotherapies we use still remain very expensive and out of reach for majority of our patients. We also treat lung cancer with radiotherapy. This may be either for the primary tumor or the metastases that may be in bone and in other sites.
Yeah.
So those are some of the modalities of treatment. You can see that it requires quite a multidiscipline, sort of management, where you need the biopsy, therefore you need a pathologist. You need a CT scan, therefore you need a radiologist. You need chemotherapy, therefore you need an oncologist. You need radiotherapy, you need that. Then you need a cardiothoracic surgeon, probably for surgery of the lung cancer. So that too, and the probably lack of adequate availability of specialists, especially in peripheral hospitals, also reduces access of good care to some of our patients.
Right. All right. And Thomas, what are some of the things that you are doing and ought to be done by our government, if not governments, to just reduce the numbers of people who are really smoking some of the products that you mentioned?
I think the civil society is coming up very strong, trying to help our people. One of them is offering free screening to the people so that you can be able to early or detect early when you have any other type of cancer. But apart from that, we are creating awareness. Civil society organizations have been so much vocal on this issue of cancer and how to prevent and trying to actually help those who are already in the situation or those who are already patients so that they can be able to join support groups and also be able to get palliative care. So, but the buck stops with the government because we believe that prevention is better than cure. So if we cannot do anything to prevent the young generation who are being targeted by the tobacco industry through advertisement, if we cannot be able to protect the young children from exposure from secondhand smoke or people who are not willing to smoke, they are still being exposed to secondhand smoke and many other types of smoke that we find around. And also the issue of tobacco farming and growing is also a factor that should be considered because this is a product that is bringing diseases and suffering to our people, including child labor and many other forms of diseases. If we cannot address it as early enough as possible, I think we will lose a lot as a country. So civil society has been vocal, trying to talk to the government. And also there is an issue of NHIF, as has been mentioned. We also urge the members of the public to join the NHIF scheme because through that you can be able to get treatment in some form or when you are suffering. So all this coupled with the universal health coverage and also the sustainable development goals, we feel that when we push together in that momentum, we'll be able to save our generation and also to bring down the cases of lung cancer and many other forms of cancer.
Yeah. And Doc, with the many cases of cancer that are being reported, where would you rate us in terms of the cost of treatment? Because most patients, when you interact with them, they say it's expensive, it's an expensive affair. Would you say the cost has gone down, and because we're experiencing so many cases of cancer, not just lung cancer, what needs to be done to bring the cost of treatment down?
I think the cost of diagnosis and treatment needs to still go lower. Like I've mentioned, the fact that the National Health Insurance Fund subsidizes the treatment has given a lot of access to many patients, but that also puts pressure on creation of other sites other than being in a city or a central area to get treatment. We need to create access nearer the people. Like for example, you know, patients don't need to travel very far to have a CT scan or to have a biopsy done or radiotherapy done. So that access closer to the people still needs to be created. Costs, I do agree with you, still needs to come down. Even with the National Health Insurance Fund, the costs of drugs are so expensive even to government. So still through advocacy, through probably innovative measures where we can be able to make these drugs ourselves, we will be able to lower the costs so that even government can afford more for their people.
Yeah.
Now, also, you know, capacity building and taking specialists closer to the people will also make costs come down, so that through infrastructure travel, patients don't need to travel very far and live in Nairobi, for example, getting radiotherapy for lung cancer.
Yeah.
But as has been raised by Tom, prevention is better than cure. We must really aim at, we do not want our lung cancer, which we think is probably higher than number 15, where we've put it in our incidence of malignancies. It's probably higher than that, but I think in prevention is where we can really, really make a mark.
Yeah.
Cigarette smoking and other tobacco sort of use of products is associated with 43 different types of cancers, bladder cancers, head and neck tumors. So other than lung cancer, by actually preventing exposure to cigarette smoke, we can actually reduce not only lung cancer, but many other malignancies.
Absolutely.
So I think that's a fight that probably can be won, and probably that's where we should, you know, try things that are achievable and we can be able to measure outcomes and make a difference should also be done.
All right, and honestly, time is not on our side. That's all the time we had for the show tonight. By Thomas Lindi, coordinator at the Kenya Tobacco Control Alliance, and then we have Margaret Waweru, and then Dr. Gladwell, Kiarie, oncologist, and then we have Ruth Wanjiku. Thank you so much for your time. We highly appreciate it.
Thank you.
All right, and thank you all for watching Family Matters tonight. My name is Purity Museo. Enjoy the rest of your viewing and good night.